You look down and see your leg split open. There is no hospital, no antiseptic, no stitched plastic package waiting to be torn open. And if the bleeding does not stop, the rest of your day may become the rest of your life. For most of human history, every deep cut was a medical emergency, handled with stone, fiber, fire, plants, pressure, and whatever knowledge your group could remember. Some treatments were simple, some were terrifying. A few were so advanced that archaeologists initially struggled to believe what they were seeing. So what would actually happen to your wound? The honest answer begins with a problem. Soft tissue disappears. A leaf compress rots. A hide bandage vanishes. A wooden splint becomes dust, while bones and teeth survive for thousands of years. That means archaeology rarely preserves the treatment itself. Instead, it preserves the result: a cut bone, a remodeled skull, a crippled limb that kept growing, or chemicals trapped inside hardened dental plaque. You are about to reconstruct the strangest treatments from those clues, but each clue has to be handled carefully. What can a healed bone really tell you? First, imagine the least dramatic treatment. Someone presses the wound. Your leg is raised, dirt and debris are removed, and some kind of clean, absorbent material is held against the cut. None of that leaves an obvious fossil. Yet, it is difficult to explain survival from serious bleeding without basic control of the wound. A hunter who watched pressure slow blood once could repeat it. A parent who saw one type of leaf irritate a cut and another soothe it could remember the difference. Could medicine have begun as nothing more than attention repeated across generations? That sounds almost too ordinary, but ordinary knowledge is powerful. The strangest prehistoric medicine may not have looked like medicine at all. It may have looked like an elder chewing bitter bark, a caregiver washing skin beside a stream, or a strip of animal hide tied tightly around an injured arm. The archaeological trail becomes clearer inside the mouth of a Neanderthal. At El Cedrón Cave in northern Spain, hardened plaque survived on teeth for roughly 48,000 years. In 2017, Laura Wyrick and an international research team extracted ancient genetic material from that plaque. One individual with a dental abscess carried traces linked to poplar, a tree containing salicylic acid, the chemical family behind aspirin. Was that Neanderthal treating pain? Possibly, but not certainly. The same individual also carried DNA from a penicillium mold, the broader group that later gave modern medicine penicillin. That does not mean a Neanderthal invented antibiotics. Mold could have entered the mouth through food or the environment, and poplar may have been eaten for reasons unrelated to pain. An earlier study led by Karen Hardy examined microscopic plant compounds in Neanderthal dental calculus from El Cedrón. The team reported evidence consistent with plants such as yarrow and chamomile, both bitter and not especially attractive as calories. Hardy argued that Neanderthals understood more about useful plants than the old stereotype allowed. Yet even this is not a preserved prescription. You can see the plant entering the mouth, but can you see the intention behind it? No. That distinction matters. Ancient people almost certainly experimented with plants, but the popular image of a perfect green poultice pressed onto every wound goes beyond the evidence. Some plants can reduce inflammation. Others can poison you, burn your skin, or seal bacteria inside a dirty cut. Learning which was which would have required failures, memory, and teaching. Now your imagined cut becomes worse. Much worse. You are a child in a tropical rainforest on the island of Borneo at least 31,000 years ago. Something has damaged the lower part of your left leg so severely that keeping it may kill you. At Liang Tebo, a limestone cave in Indonesian Borneo, archaeologists uncovered the skeleton of a young person known as TB1. The lower third of the left leg was missing. This was not a foot lost after death, and it did not resemble the ragged destruction expected from a crocodile attack. The tibia and fibula ended in clear cutting margins, followed by years of bone remodeling. What kind of person could do that with Stone Age tools? In 2022, Tim Maloney and his colleagues published the discovery in Nature. Their conclusion was extraordinary. The limb had probably been deliberately amputated during childhood, and the patient lived for another 6 to 9 years. The remaining bones became smaller and thinner from restricted use, while the cut ends closed and healed. Think about everything hidden inside that survival. Someone had to cut through skin and muscle without causing fatal blood loss. Someone had to avoid shattering the bone. Someone had to keep the exposed wound from developing an infection severe enough to kill the child or permanently mark the skeleton. Then came the long recovery. Food had to be carried. The body had to be kept warm and clean. The injured child had to be moved across rugged cave country or supported while the group moved around them. Does that sound like a lone prehistoric survivor? It was the opposite. The operation was only the beginning. The real treatment was a community refusing to let the patient die. Researchers cannot identify the exact painkiller, dressing, or antiseptic used at Liang Tebo. The rainforest contained a vast pharmacy of plants, but naming one would be speculation. What the bone proves is narrower and more impressive. The cutting was controlled, healing was prolonged, and care continued for years. A surgical act that looks brutal from the outside may have been an act of rescue. And that was not the only time stone touched living bone. More than 7,000 years ago, at Ensisheim in what is now France, a person underwent one of prehistory's most unsettling procedures. A hole was made through the skull. Then another. In a 1997 Nature report, Kurt Alt, Christian Jeunesse, and their colleagues examined the Neolithic skeleton. The skull contained two openings made by trepanation, meaning bone was deliberately scraped or cut away from the head. Both openings showed healing, including one very large defect. The patient had survived not merely the operation, but long enough for the edges of the bone to remodel. Why would anyone allow a stone blade near the brain? The motive remains uncertain. It may have been an attempt to treat head trauma, pain, seizures, or another condition. It may also have carried a ritual meaning that no skeleton can reveal. But this was not simply a hole punched into a corpse. Living bone reacted. Living bone healed. Whatever the reason, the operator controlled the tool well enough to open the skull without immediately killing the person. The technique may have been scraping rather than chopping. That difference is everything. A sharp stone edge moved repeatedly across bone can remove thin layers with surprising control. Slow scraping reduces the chance of plunging into the tissue underneath. It is still dangerous, still painful, and still almost unimaginable without modern anesthesia. But it is not random violence. Now travel farther back, into the world of Neanderthals. At Shanidar Cave in Iraqi Kurdistan, one skeleton became famous because its owner survived a catalog of injuries. Shanidar 1 had severe damage affecting an arm, signs of trauma around the head, and other physical impairments. The exact cause of the withered or missing lower arm remains debated, so it should not be called a confirmed amputation. Yet the individual lived for years after major disability. Archaeologist Penny Spikins and her colleagues reviewed Neanderthal healthcare in 2018. They argued that survival after trauma was not a single lucky accident, but part of a wider pattern of care. Other Neanderthal remains show healed fractures and injuries that would have limited movement during recovery. How do you keep hunting, gathering, and crossing rough ground when one member cannot keep pace? You change the behavior of the group. You share food. You protect the injured person. You allow recovery to take time. That may be the counterintuitive twist hidden inside prehistoric wound treatment. The most important tool was not the sharpest flake, the bitterest plant, or the tightest bandage. It was another person. A dressing can slow bleeding. A plant can possibly ease pain. A skilled hand can scrape bone or remove a ruined limb. But none of those acts explains years of survival on its own. Recovery consumes calories. It slows travel. It exposes caregivers to blood, waste, and infection. Helping an injured group member carries a real cost, especially when food is uncertain. Why pay it? Because the injured person is more than a mouth to feed. That person holds memories. That person knows water routes, animal behavior, edible roots, dangerous seasons, family bonds, and stories that organize the group. Even a child unable to walk is still a child connected to parents, siblings, and a future. Care does not need to begin as a calculation. Attachment is enough. Compassion is enough. And once care becomes normal, knowledge accumulates around it. One generation discovers that pressure stops bleeding. Another learns which fibers absorb without falling apart. Someone notices that a certain bark changes pain, while someone else becomes exceptionally good at cutting, scraping, or setting a limb. How many unnamed experiments stand behind one healed skeleton? Thousands, perhaps. Most left no trace. That is why the surviving evidence can feel so weird. Archaeology gives you the spectacular edge cases, a missing leg, holes in a skull, chemicals locked in ancient teeth. It rarely gives you the quiet nights when someone changed a dressing, brought water, or stayed awake beside a feverish friend. Modern medicine surrounds you with specialized tools, sterile rooms, tested drugs, and knowledge recorded in books and databases. Those systems transform survival. A prehistoric treatment should never be copied simply because it is old, and a bitter plant is not automatically safe because an ancestor may have used it. But the deeper pattern is still familiar. When you clean a child's scraped knee, press cloth against a cut, or sit beside someone who cannot care for themselves, your hands are doing something far older than any hospital. The materials have changed, the precision has changed, the odds have changed beyond recognition. The first principle has not. You look down and see your leg split open, and the reason you may survive is that someone else looks down and refuses to leave.